Yeah, so I'm Damian Taylor. I'm a clinical psychologist and the clinical lead for the Community Rehabilitation Service. Okay, so within our service, so there's two bits to my job. One is being a psychologist and one is being the clinical lead. And as the clinical lead and a psychologist, it's to try and ensure our service maintains a psychological perspective. So we work within the PI model, the psychologically informed environment. So it's trying to make sure we understand people's problems within a psychological model. In terms of what I do day to day, I do some direct work with service users, training, supervision, a lot of stuff around the development of the service and the model of the service as a whole. So there's quite a lot of going to meetings and those kinds of things, as well as some more direct work with the team. There's an accommodation bit where people can stay there for up to 12 months, but often people stay for a lot less than that, but it's up to 12 months. And there we can provide a whole range of things to help people develop their living skills. So the idea is to be able to move on to more independent living. And the other component of the service is the community team, where we work with people more in their own homes, so it's supporting people in their own homes. And that's about helping people to identify recovery goals and then work towards those goals. And we have a range of people in the team: peer workers, recovery navigators, occupational therapists, nurses, psychology, psychiatrists. So we can provide a whole range of practical support, psychological therapies, occupational support, reviews and medications, a whole package of things that can help people towards their recovery goals. So I guess the key change from the start of Bristol Mental Health is having more Bristol-focused services and bringing a whole diverse range of services together, so some existing ones, some new ones. So the key bit really is the partnership working, and the key to the success of Bristol Mental Health is for those partnerships to work well together, which is, for me, is about maintaining what's unique about each of the services while also creating new ways of working. So in terms of our team and Bristol Mental Health as a whole, that seems like the key to me. In terms of other services we work with, we work closely with the assessment and recovery teams. We have a lot of referrals from them, and also some people will be moving back to those services. Early intervention psychosis, the inpatient wards as well, we have quite a lot of contact with. And then more broadly, there's the other services, so the ACE team, the Assertive Community Engagement team. But we're happy to kind of discuss referrals with any team within Bristol Mental Health. We've had some referrals from the Wellbeing Service as well. And the way that we work, we're always happy to talk about referrals. So if somebody's a bit unsure, then we're happy to go and meet with other teams. And even if we don't take somebody on, often there's ways that we can provide some input or advice to other teams that are working with people. My role, which is a change from past roles, involves less direct work with service users, which was one thing that I always used to enjoy a lot in my role, but it involves a lot more working with the team. And one of the things I really like about this job is we have a really motivated, skilled team. So I like working with the team. There are lots of ideas, lots of enthusiasm. So yeah, I would say it's working as a whole with the team.